Good afternoon, everyone. Be welcome to our startup pitch for Hive in the area of health, our Colmeia Summit event, and we will be able to interact. I will introduce myself in a few minutes. I am Ilana Horta. After working for several global companies such as Uber and Google in Brazil, I became passionate for startups. I am a co-founder and angel of 11 different startups in different segments. And like me, I hope you are enthusiasts of this topic. It's become clear that we need to innovate increasingly, especially in the area of health. And this is more and more tangible. We see material chances of innovating, and this has been a very popular idea in the last year. Thank you for being with us, and I would like to ask our debaters to introduce themselves. I feel very privileged and honored to have both of you with us, so I will ask you to introduce yourselves, beginning with Gilney Bastos, the CEO of White Martins. If you want to focus on innovation, especially in the last year with the pandemic, please feel free. And José Carlos also. Hello, I am Gilney Bastos. As Ilana said, I am CEO of White Martins since 2017. Actually, I am responsible for the lead company, which is called Latin America Sul, and it corresponds to all countries in South America up to Colombia. And Colombia upwards is under responsibility of our Mexican area. So I'm very happy to talk about White Martins' market here in South America. In the last 2 years of the pandemic, we did not see many innovations. We saw actually many struggles. We are involved in the whole situation. We have many people working in the front line, not directly, but we cannot stop producing and delivering our products. A lot of interaction and customer service. In Brazil, we have over 2.2 thousand people in the front line in direct contact with hospitals and health institutions. And this is our role, to contribute to society. We learn a lot from it, and together with that, we have innovations which are that must be done and developed since the last years, and we're very anxious to contribute to the country and to the startups that will be here. This is a great contribution already. And now we will have José Carlos Felner, CEO of GSK Brazil, one of the largest companies globally. And as Gilney, I'm sure you're working with this synergy between the traditional business model and the startups. Thank you, Ilana. I am José Carlos Felner, CEO of GSK Brazil, over 40 years in the pharmaceutical market. And the innovation agenda is extremely important. GSK has a very diverse portfolio, very innovative systems. We are leader in vaccines and HPI and respiratory diseases. And what's the difference and how did this come in our agenda? We are very strong in innovation until we register the product. But in the market, like a very traditional British company, we see many risks. So this is what we have in our DNA. So a few years ago, we began a strong innovation program to change our culture, more specifically here in Brazil. So we started a program, and in the beginning, a few years ago, we have involved over 200 startups all over the world. In 20 years of these projects, 5 of them were very successful. It changed our culture greatly. And living with the startup population brought new oxygen for us. This is a joke on White Martins for our teams who began to also have fun with this innovation process. We also changed our culture. We began to focus on the learning process and not specifically only on success. So we went down this road with lots of automation, many robots working. We no longer need to sign documents, for example. And in 2019, we started an experiment. We simulated what would happen if the company were totally remote, simulating a tragedy, and the whole company operated and functioned perfectly. And we didn't imagine we would have the pandemic and COVID, and it did arrive on March 14th, 2020. So it showed the importance of our dedication to this pillar of innovation. So when it really happened, people were very much prepared. Of course, it was a tragedy, but in terms of functioning for GSK, it was actually fantastic because it was a validation of everything we had been working on. And we must, of course, leave the human being for the more noble processes and use the machine for the rest. We have several robots. One of them is Jessica. She is a very polite redhead, very gentle and kind, very popular now. Now we're going to change her wardrobe for 2021. After all, a female figure needs that. And well, it was a big pleasure. And I'm also very happy to be here with you. Thank you. Thank you for being with us. The venture capital brings a lot of synergy between the more mature business model and the startups. And we're here today for the startups to learn from them, to hear them. And our first startup is actually a junior company called Magic Junior. So I will have to bother you with the timing. You will have 5 minutes for your presentation. And then I will also be nagging our debaters to keep to their time. So let's start. Hi, everyone. Good afternoon. Let us please share the slides. My name is Ana Flavia. I am the commercial director of Magic Junior, and I am here to present some of our work to you. Magic is a junior health company from the Federal University of Juiz de Fora, and we are guided by managing physicians from the city and the region. Our major purpose is to bring change to the health market, and this is done in 2 paths. One is education management and entrepreneurship. We do that with our members, generating events to disseminate good business practices. And the other path is providing services to health companies and creating solutions so that they can develop their businesses and products and offer the best care for their patients. And we have within that brought some solutions and services that can be individualized, but I brought them to present as programs to make it easier to understand. We have the commercial speeding acceleration program, which is for startups, franchisors, and larger companies. And depending on the moment at which this company is positioned, we offer a series of possibilities. So we map the market, we validate the demands, we elaborate a commercial strategy based on that mapping. that we have produced according to the client. And within the strategy, we set up teams, we develop playbooks, everything that can be a need for our client. Besides that, we can prepare teams. We have our own designers working in companies with DDRs, etc. And besides, we validate the model that we propose. So it's not simply to deliver a service, but also to ensure that it is adequate for the reality. Our second program is for client engagement and retention. It's for the health companies. It includes health clinics all the way to large institutions and services. We analyze the client's experience. We validate bottlenecks. We produce new proposals. And from there on, we develop a strategy to engage clients, thinking about the patient experience and medical client in a startup, for example. We map everything and we formulate strategies and hypotheses, and we validate them as we learn from the process and from mistakes. And we also don't transmit costs of failures to our clients. And the third program is the technical and economic feasibility analysis, which is a more complex product. It is for services. We analyze the market. We first perform a technical survey of all the legal and technical rules involved in the service, and then we provide a financial study to validate the service, and we also recommend where it is more strategic to invest in the beginning. I know I was very fast. These are my contacts, and now I am at your disposal for your questions. Thank you for your presentation. Actually, you gave us one minute and a half more for our questions. So I will begin with a question, something that I didn't understand initially, and then I will give the floor to our debaters. What is the format of your solution? Because I got the idea that it was a consultancy, but for consultancy, you need headcount, and that is not scalable. So I don't understand exactly to which extent your solution is automated and how you deal with databases, especially LGPD. Well, it's actually a consultancy. And the structure is very simple. We are medical students who are getting together to try to learn management. And for that, we decided to work as a startup so that we can learn about the future and future innovations in health. So we don't work with automation to a great extent. In the technical economic feasibility study, for example, we have people, experts who will estimate the number of images according to the number of collaborators and the expected number of patients. And then the client himself can draw his own conclusions about what investment he needs to make. But as for LGPD, we actually do not treat our customers' data regarding the law, LGPD, the privacy law. My question is about who is your target public? Do you work more with hospitals? I can understand that with new clinics or hospitals or with physicians. Yes, we began by working with clinics, polyclinics mainly, and then we saw a potential to grow the size of the institutions. We have been working with hospitals, franchisors, startups also. We try to diversify as much as we can because our purpose is to learn about the market and the reality for professionals. And with everything that you've learned, how do you see a future projection of the medical segment in Brazil? I believe that there are many possibilities. Increasingly, companies have been understanding the value of having medical students in their work environment. We see several medical students working with startups in different areas that have nothing to do with medicine. I myself, for instance, work in the business area of a startup, and I learn a lot from it. So I believe that the future of medicine is exactly to be infiltrated in the business world so that they can deliver a service to their end customer, to the patient, that is higher quality. I believe that this is our future, especially being medical students. One of the questions I had has already been answered here, but another thing I was thinking about is about the credibility of your project. I see you have local guidance, but when you want to expand, you will need to expand this credibility also. So the challenge is that if you are so localized, or if your base is so limited geographically, if you want to expand the geographic location, there's no longer a limitation. So I was curious about this very broad aspect and scope that Ilana also asked you to clarify, although the proposal is very clear, but the scope is a little bit fuzzy, at least after this very fast contact. So how will you deal with the credibility to engage larger and larger and more diverse companies? This is one part of the question. And on the other side, the little experience you have.
Well, actually, this is something that we experience all the time. So we are used to that type of questioning. I mean, we have cases that are really significant. You can check them out in our site, and they're really interesting cases. And it exactly deals with that. I mean, it deals with the fact that we send people to work in-house in the companies, even though we are third-party consultants, but we work in-house because we identify the flaws from inside, and we can really show which are the problems, and we know because we felt them in our skin while we were in the company, which are the problems. So it is really a very good experience because we will deliver quality service, and these monitors, I mean, we don't depend so much from these monitors. They're actually a institutional, a formal relationship. But actually, when we want and look out for benchmarks, we look them out. We have invited CEOs of major Brazilian companies. We invite them to talk with us and debate, because this is what adds value in this learning experience. And I mean, we make it ultimately. We can deliver. So, okay, thank you very much for our speakers. It was great. And I will leave a suggestion, something to think about, which is a reality outside custom-made healthcare services. So this is a possibility for the future. Let's carry on with our next startup. All the best. Congratulations on your presentations, and congratulations for being in this fantastic area, which is taking care of the health of our fellow human beings. So I would love to be a medical doctor myself, actually. So our next startup is Cisneg Tati. I have met Tati from other areas. Tati, welcome. Hello, Carol. Hello, Ilana. Here you are. Hello, Carol. Carol, just let me take a look at my notes, because I'm doing 3 things at the same time. And let me find my presentation. Carol, great. Cisneg. This is our next startup on health and wellness. You can start, Carol. Great. I am Carolina Bassier. I am founder and CEO of HisNeck. HisNeck is a health tech, and our purpose is to prevent corporate environment, mental health disease protection through our program. We are the virtual assistant in mental health, and we have more than 1,000 clients. We have a Oxygenio acceleration startup plan. And why do we work in this area? Because mental health pain is very, very terrible and became all the more terrible during the pandemics. The World Health Organization says that 1 every 4 persons has some time of mental disorder throughout their lives. And there are 350 million people with depression in the world. 47 don't even realize that they have a depression disorder. And in Brazil, there are 12 million people that live with depression, 19 people with anxiety disorders. And we do not know, we don't have enough medical doctors to take care of all of these patients because there are 5.8 psychiatrists per 100,000 inhabitants, mainly in the south and southeast of our country. So in order to effectively take care of our mental health in a preventive manner, we need to provide a solution that will use technology and try to make people feel better when we can identify and take care of vulnerable and milder cases through technology and refer more complex cases to a medical doctor. So this is our solution. In 1920, we developed Hive, which is a well-being and mental health virtual assistant. Hive's mission is to prevent mental health diseases in corporate environments. And we do this because in our algorithm, we have a 100% validated protocol algorithm for mental health. So what do we do? Through this interaction, we understand that we can use this virtual assistant, and depending on where you are in this pyramid, if you're in the lower part of the pyramid or in the upper part of the pyramid, depending on your disorder and vulnerability. So we identify different users. The greater the emotional vulnerability of the user, which is from yellow up, green, and lighter green, we understand that for these users, our intention is to try to make them feel better. In green, they are healthy. If we find a vulnerable user with depression or anxiety, other than Hive with the virtual assistant, we can monitor these users and refer them to clinical care with psychologists or psychiatrists. So this is the cycle. We use the app in this way. The user interacts with Hive. Hive identifies pain through protocols used in our pyramid, and with the identification of these protocols, Hive suggests interventions for specific pyramid layers, maybe technology or more clinical solutions. And all of these interventions generate a corporate intelligence VI that the company will use to understand mental health reports of areas, clusters, and employees. So what is our edge? We're not online therapy. The thing is that we use AI for healthcare with personalized interventions, with ongoing monitoring of users, and we generate a corporate intelligence. We are a pioneer company that is not online therapy. Rather, we believe that prevention is more important and identify possible patients before they reach the therapy stage. So thank you very much. This is our link. If you would like to go through one of our interventions, just click on this QR code. I'm here, Ilana, for you. 5 minutes. Great. You did it. Yeah, I rushed. I know I rushed. Yes, but it's funny because Carol, just let me put you into context. Carol asked, I mean, we are talking about the startups, and I remember Carol when she was in the food industry, healthy food in corporate world. So I believe that you changed gears, you changed areas, and people are totally distressed. And I believe that what you're doing is great and necessary, and it's a growing need. And I believe that we will increasingly suffer more mental disorders. So Carol, so many years I haven't talked to you. Carol, tell me, what about the responsibility of the diagnosis? Because unlike other platforms that have peer-to-peer, where we have the psychologist together with a user, and there is a responsibility of the care provider with a user, you are halfway in the middle. There is a diagnosis of a possible mental disorder. So what about the responsibility in your app with your artificial intelligence, with your protocol? The thing is that Hive does not diagnose. We use monitoring protocols, and these anxiety protocols and depression protocols, which are certified here in Brazil with 80 and 94% assertiveness. We can't diagnose. The only ones by law that can give a diagnosis are medical doctors. So there is a monitoring and tracking protocol with a very high percentage of correct answers. And yes, we can identify symptoms of depression and anxiety, and they receive the appropriate suggestion, for instance, to make an appointment with a psychiatrist or psychologist. The percentage of persons that have a mental disorder and do not look for help is enormous. And if we go on, and that is, this person feels that no, he or she feels sad, but it's not depression, it's just a momentary bad day, it will increasingly worsen. And we want to tackle with this situation in the preventive stage. Yes, this is very interesting, because to prevent is cheaper than pay for a health insurance alteration fee. Well, Jose, Gilney, well, I just want to ask you one question. I thought it was great, so interesting. I was reading about what you're doing, and you're focusing on not absenteeism, but rather presence of workers at work. But when we want to deal with absentee rates and leave rates, it's a different perspective. Hive is working with workers that show up and are working. So we know that corporate anxiety and personality disorders is caused by different factors. That is, maybe it's a consequence of the cultural relationship with your leaders in the company. Maybe a bad relationship with your leaders can cause anxiety. Maybe working conditions themselves. Maybe the nature of your job. Maybe workload. You can generate frustration and anxiety, low self-esteem. I mean, there is a number of elements that are present in the corporate world apart from your personal characteristics, your personal life outside the corporate world. So I believe that what you're presenting is really very interesting, and congratulations, because this, what is the percentage of accuracy of your diagnosis? I have an employee, I get your report, and we're talking about behavioral therapy. We refer this person to a psychiatrist or psychology. What I haven't clearly understood is if this diagnosis is clear? And what is the level of complexity and diversity of information in the diagnosis? Yes. Thank you for your question, Felner. Well, actually, we have a monthly report that is sent to the company so that the company understands how their company staff is doing. If they have, of course, it's anonymous information on anxiety and depression percentages, but regardless of reports, I mean, reports are the cherry in the pie because what we're doing, I mean, regardless of the causative root cause, if it's a toxic boss or leader, if the patient has depression or anxiety, the fact is that if this person develops a disease or a disorder, it'll be a greater spending in your corporate life. So the focus is that we need to keep those that are in good health, keep up their good health, and those that are in a more vulnerable situation, try to correct and monitor this situation before it becomes a disability or disease. So what was the timeline in the evolution of this condition in this person? Of course, what we do is use data to take care of mental health. And what we can do, for instance, organize clusters per area, age group, localization. I can even give companies an idea if there are leadership issues, for instance, or if maybe they're working long hours. So there are two perspectives. On the one hand, regardless of whether the company decides to do something with this report or not, but then a report provides a very transparent perspective on how the environmental and emotional environment is doing, and if there are outliers, negative and positive outliers in any area, gender, age groups. We have seen that millennials are more anxiety than mature persons, elderly patients, and this is related to Pearson's analysis. So when we have information of this nature, if there is a corporate culture that is really paying attention, this will provide the way forward to try to implement programs and training sessions focusing on millennials. Because, Ilana, sorry. No, we're running late. I think we're really running late. Gilney, would you like to make a comment? Sorry, I interrupted you. Well, no, I realized that we were running late, and I would like to just make a comment, and a quick comment, Tati. I think that your initiative is great, very practical and very current. If you have an app that is as precise as you have been in your presentation, you will do great. But I guess everything that you mentioned is great because our company has more than 4,000 employees here in Brazil, more than 200 management areas. And I think it will be really very interesting, not only because of the pyramid that you presented, but participatory management is very complex. And the question, Tati, is the following. You showed the pyramid, and the basis of the pyramid was green. After 2 years of pandemic, home office, remote working. I mean, what happened with the pyramid? Has there been any changes in the pyramid? Do you find a different scenario after home office is the new normal now? Yes, we see that there is a high increase of chronic anxiety disorders in women and millennials. And even, I mean, it is so difficult that even the tool was not done for this purpose. We helped a woman get a solution for domestic violence because she reported the situation. She reported the situation and we could help this person out. So, Gilney, we didn't realize that there was a peak of mental disorders or diseases in the pandemic. Yes, of course, those that our COVID patients have 30% more possibilities of developing a mental disorder. But it was great. I'm sorry I interrupted you. It was so interesting. It was great to see you, Tati. Congratulations on your presentation. And it was great. Thank you. Thank you for the opportunity. Thank you very much for your attention. Bye-bye. Our next startup is Soft Pill. Is it right? Did I pronounce it correctly? Safe Pill. Safe Pill. That's it. Maybe there is a little noise and echo in your audio. Safe Pill. That's the name. Okay. Would you like to share the screen? Yes, please. Safe Pill. 5 minutes. Off you go.
Safe Pill is a startup based on the Einstein Services model. Our idea is to help patients who are polypharmacy, who take several medications a day, to relieve them from the work of going to the pharmacy. And this, of course, will not help his treatment. He has to go to the pharmacy, several pharmacies, and look for different medications, have different numbers of pills. And when they go back home, they have to deal with that problem. They have to take 300 pills and organize all of them alone without any professional help. The patients have three major issues. First is the wrongful medication. This is the famous, well-known model to analyze this. It can be used to measure the medications taken at home. We're talking about over 9% of the Brazilian adult population who take over 5 pills per day. Another big problem, and a chronic one, is the low therapeutic adhesion to therapy. And the patients along their life, they have different problems, and this is a WHO website in Portuguese showing how much people spend and only to adhere to medication. And this other problem is drug interaction. And here in Brazil, the Federal Pharmacy Council has registered a very large number of hospitalizations per year as a result of drug interactions. These are some other studies that corroborate this. Up to 50% of a U.S. adult population end up abandoning their prescription medication. And 1/3 of these patients will re-hospitalize up to 6 months after they left the hospital if they have to take more than 3 pills a day. We will try to start the video, please. I don't think we can show the video. Oh, what a pity. I'm asking the technical team whether we can play the video. I'm interrupting the clock until we have an answer. Please message to us. No, we cannot see videos. We cannot play videos. So let's go back to our clock. Next slide. So this solution is quite mature in the United States. Amazon, United Health, and Walmart are very active in the individualized medication market. The medication is delivered at the patient's house with fractionated medications. All of it is checked and validated by a clinical pharmacist. They also pay attention to drug interaction and other issues. And therefore, we have a 30-day period for treatment with separate packages for different medications and different times for taking them. And this solution has been increasing patient engagement and adherence to treatment. We have 1 more minute. So all the problems that we saw in the Swiss cheese can be solved, all those holes. We have a pharmacist validating electronic checking of the process. The process is automated. We have special equipment and systems developed by ourselves and by SafePill, and the layout of the unit dose helps us in storage and management. So we offer to patients autonomy in treatment, a more healthy life with less rehospitalizations, smaller stress level, lack of concern on the part of the family, and more quality time with the family. Let us see the last slide now, please. I asked you to advance so that we can see the product itself. So yes, this is it. So each package comes with the strips for each medication to be taken during the day or during the night. All meds are separated. All of them are traceable also. And we have all the information to trace the drugs. It's a very secure and safe process, and it is authorized by Anvisa, the health regulator. Thank you. Time's up. I will ask you something I was in doubt about. You have a package with several packages. So how big a team do you need to filter all that? And my question actually is, what is the difference in value or consumer price for them to be encouraged to buy their own package from SafePill? It needs to be a reasonably low amount or value, enough to make it an alternative, a feasible alternative for the patient's consumption. Yes, first of all, the team we need is minimal. We have equipment that were developed here. We have our own machines. So the operators do not interfere with the machine. The productivity, therefore, is very high. And we don't have any problems with scale. The value of the drugs they pay is the same value that they pay at the pharmacy. So we're highly competitive with the drugstore chains. And for the packaging, etc., they will pay an amount of 34 reais and 50 cents per month. It's a very reasonable amount. And especially in the beginning, we are working with this very low price. Yes, you allow me a question. I'm sorry if my memory doesn't work here, but there is a company like you in one of our speech day events 3 or 4 years ago. Is that the same company? No, it was not us. Oh, okay. It was another company with a similar proposal. My permanent doubt as a supplier, I work with several channels. We have chains, independent stores, etc. Our major concern is with 2 points. And this has to do with the reputation of the original company. One is the co-responsibility for quality. So my question is, which processes ensure that the quality specifications that we recommend, how can you ensure that this quality will be maintained? Because you will open the packs. And number 2, what about the competition law? There are rules regarding the price that consumers pay. They have to be audited. So how will you ensure that the patient's purchasing capacity will last? And besides, how do you deal with co-responsibility? Because after all, you end up being an additional commercial channel, a new one, but one more after all. And then you would not be subjected to sanitary controls and everything that is involved in a competition law. So 3 or 4 years ago, I heard the same presentation and I asked the same questions that I'm asking to you. So I still have the same doubts. But it was very interesting. When I am older, I will surely want and need something like that. Thank you very much. Well, with regards to our controls, I am a nurse by training. I work for almost 17 years in institutions. One of our mentors come from Anvisa, the regulatory agency, and from other institutions. So everything was done strictly under the law. So we have a clean room to treat our medications. All of them are traceable. All of them are individually packaged and registered. And we are beginning to have partnerships with the industry. And therefore, we were able to establish the best practices. We have been quite complimented by the health surveillance agency that visited and got familiarized with all our processes, equipment, and setting up of the orders. So we are very proud, and we provide very strict control according to the market practices. As for the commercial control, we also comply with all the parameters regarding consumer price. Our team is also working with us in terms of supplying drugs, and we are running out of time because Gilney also has a question, so we need you to be faster, please. Okay, so I hope I have answered all your questions. Yes, okay. These were the gray areas for me. But I confess, I agree that these controls need to be very strict. Yes, we have all the necessary permits and authorizations. The step that Felder commented is actually critical. Once you have the permit of the health surveillance, it is a very practical, up-to-date, and good alternative. And I myself have a situation in the family which would be very conveniently serviced by your enterprise. My father has heart disease and he is a diabetic, and my hardest work nowadays is to check whether he's taking his medication correctly. So besides being very nice, I think that the success of your company would be actually related to the cost. The lower the cost, the best you will be able to cover your target public. And I'm sure you will have many segments interested in your company. And it will be very important to always have your permits and authorizations renewed properly. Congratulations. Thank you very much. Thank you. Now we are going to Salvos, a very high level of startups that we're seeing here. Congratulations to our curators. Oh, it's a pleasure now.
Okay. Okay, Salvas, it's your turn now. Hi, everyone. Thank you very much for the invitation. And my presentation will focus on this initiative. I'm Master Gomez, I'm CEO and founder of Salvis. We can go on. This is a startup that provides healthcare, distance and home service for the future. And we try to develop this by the development of a software, highly state-of-the-art and complete software that can be plugged and played in any hardware. So what we focus on is two major issues in healthcare. First, the waste of money, which in Brazil is 30% of everything invested is wasted, not only in Brazil, this is a global average. The United States also have these figures. And this also has to do with deaths or malpractice in home care with a very precarious return of hospital systems with a more complex situation for families of patients. So throughout the last years, we have won several awards. And look at this award. We won the first place of the first startup with the support of the first National Internet of Things program from the National Development Bank here at Brazil, BNDES, that also included other multinational startups, and we won the first prize. So it really shows how committed and how serious we are in what we do. Well, what we're doing here is we focus on home care, and we understand that home care companies are going through a very difficult situation to keep up their profitability and efficiency of operations. And this, of course, includes different situations that are a consequence of risk or waste, not only of hardware, but also of items and drugs used at the patient's bed in home care. So to overcome these issues, we created this platform, HAI, Health Assistive Intelligence, that is a computer-assisted assessment program for the assistance and implementation of home care, with the possibility of scaling up the system without losing quality along the way. This platform has different layers of interoperability. We can plug this in any computer, MVs, RPs, data loos, need, CADs, with very robust softwares that are compatible. And this platform, HAE, can interact with other management platforms. And we are also including different functionalities for home care use of our platform. Well, this is the example of one functionality of our system. We decrease planning time of appointments and scales within our AI algorithm that classifies and rates the best professional for home care based on the technical profile and the challenge he will face depending on his activities and personal agenda. So this platform has a web-assisted system and an app with a dashboard to follow up indicators and metrics with real-time information. Next, please. And we included other devices with more intelligence for the full administration of oxygen therapy. This device connects sensors in oxygen and pressure flows with a real-time monitoring for companies to have a real and exact figure on stocks and flow so that they can precisely optimize logistics and home care, preventing risks and waste in home care. Thank you very much. Thank you. Thank you. No, if you wanted to wrap up, you still have a minute, even though we ran out of time. I'm sorry for interrupting. No, this is it. Thank you very much. I think that we can leave the remaining time for the Q&A. That'll be great. Thank you very much. Okay. Gilney, isn't this great? I mean, yes. Gilney, yes, I think that your app is really great. And I think from my perspective, if you can trace and using AI, you have more precise results. And this is essential. And if you put everything together with a good network and a server, I mean, this will take you wherever you want to go. So you only need to be careful with one thing because home care in Brazil is based on state health departments and the SUS, which is the state health service. So you need to watch out for that. But I guess that what you are really offering with your software has a lot of functionalities. And let me give you a quick suggestion. I think that you could think in the area of oxygen therapy, not only focus on pressure and flow meters, but also patient oxygen levels. If you could monitor patients' oxygen levels, you could even save more costs because you will be able to decrease oxygen flow according to the patient's oxygen levels, reducing your scale. So congratulations. I guess that, well, you are a great company and you won great awards. So I guess that this is the way forward for healthcare. Let me make a comment here. First, I believe that as far as home care is concerned, this is a international trend that we also have here in Brazil with more than 20% increase of beds and intensive care beds in home care modality with a 30% increase in all home care ecosystems, tests, and different protocols. So this is why our platform helps you provide greater profitability for companies. And with a device integrated platform and with all the monitoring devices that we already have and following different protocols of home care monitoring, we can automate and change parameters in oxygen therapy. So what we're doing here is we're developing a more advanced clinical validation process with 1,200 volunteers for different devices that perform other types of monitoring activities to leverage the possibilities of the platform. And why won't White Martins give us the possibility of testing a pilot with you? We are registered with the registration agency here in Brazil, Anvisa, and it would be great if White Martins can give us the possibility of running a pilot with you with 4.0 technology, and I guess this would be great. This is making the best of an opportunity. Yes, don't worry that I will refer your request internally to the appropriate levels. Congratulations. Wow, maybe a possible partner. Felner, would you like to make a comment? Congratulations. Congratulations. Throughout the years, we always need to focus on new opportunities, and home care is an undeniable new frontier that is always related to sustainability of the service provided. And even the private market for patients that can enjoy this modality. Congratulations on your initiative. And my question to you, my suggestion to you is the following. Considering that there are costs involved and you have this great platform and you have 4.0 technology, and considering your project's sustainability and wider coverage, there are different healthcare variables, not only drugs. You mentioned diagnosis that could be introduced to your platform, because the main scope or the key initiative and what you're suggesting with White Martins can develop other issues like quality control, etc. But for instance, when we talk about home care, there are many initiatives that can ultimately fail due to lack of economic sustainability. So there's plenty of room for cooperation. These two variables that you already use, maybe you can incorporate or invite other partners to provide a more comprehensive home care experience with other variables included. Congratulations. Congratulations. Thank you. Thank you very much for the opportunity. And thank you. I mean, we will introduce other possibilities. And thank you very much for your time and the opportunity to be here. Thank you. Thank you for your presentation. Congratulations. And now we give the floor to our last startup in our blue startup. The last 5 minutes and 5 minutes to talk about the presentation, doubts, questions. Well, first of all, good afternoon. Good afternoon, Gilney, Felner, Ilana. Hi, everyone. Well, it's a little bit different from what you've seen from the other startups, because Blue is a company that can work in any segment, the healthcare segment or any segment, because it can transform people to transform the world. Well, as I mentioned earlier, Blue is an education initiative. We are an EdTech, a technology-focused school for the development of tech professionals with training courses for software developers, analytic developers, and we also have an important social and economic footprint, and we identify talents and give them the opportunity to develop their technical capacity, giving them support and a possibility to have a chance with headhunters, and our initiative is try to help and mitigate the gap there is between technology professionals and job opportunities. So, which are the forecasts? 420,000 openings in the tech sector till 2024. This means to say that, according to some announcements in the media, there will be a collapse of the technology area in the future. And this is a very bad thing for Brazil, because Brazil can't develop itself technologically, and we're always running behind other countries that consider themselves more technologically forward. Ilana, you can go on. So, our idea is to identify talents with potential, invest in their technical training. I will tell you how we invest on their technical training, and we adopt best market practices. And in 6 months, Bloomer, which is our student, will be ready to work in your company. So he will return the investment once he is employed in the market, and he will pay back this value in 36 months. So, in very simple terms, I want you to see which is our methodology. We have 2 semesters. The first semester focuses on hard skills, that is, technical skills, preparing the professional for the market. And then the last 6 months focus on soft skills with behavioral skills, technical English, which is a basic prerequisite for any developer or technical professional that can't survive without technical English. So we provide all of this training in 6 months to enter the labor market with all of these skills. So our proposal is exactly have partners as White Martins, JSK, and all of the partners that can help us to make our initiative known and have access to scholarships and train all of these professionals for market demands that all technical and healthcare areas will need in the future. So, please. Well, this is, yes, I mean, that was the last one. And that's my contact information. And Gilney, José Carlos, thank you very much for your attention. Congratulations. Congratulations on your presentation. I think that this topic is really very, very appropriate. There is a tremendous gap between what we learn at school, at university, and what the market really wants to absorb, especially now with the pandemic, that online services have grown exponentially. So this makes perfect sense. From the perspective of cash flow, there's a doubt. You charge when the person graduates, but you make an investment now. Where does the money come from? Where do you get your initial capital? Well, we have an initial contribution with a teaching service that will provide this content, and we work with this initiative that we have to work on the technical part to work on the possibilities that we have in the future. So there is a possibility that we have to focus on with investments from the private sector, and then when the student graduates, they pay us back.
So the US market is more mature than ours. So the reference is there. Perhaps there's an attention point for you to understand that. So that you have to pay attention, so not to go into debt. Of course, this is very good, this possibility that you're bringing. I think the market tends to transform itself in a sense, for sure. We see things developing very much in Brazil and following the road trend. It's not a criticism, actually. I just don't see this deficit of manpower that you mentioned. In our company, for example, we have a digitization department launched 3 years ago, and it's been growing a lot. It's very easy for you to find room to interact here and there, something quickly. We have 280,000 1,000 customers that consume oxygen. The digital part, it can be separate for customers that buy sometimes, those that buy constantly. When one of the customers does not buy, well, you don't have to know. The digital tools provide you all the information. So we've been growing this department quite a lot, but we haven't found any difficulties in terms of hiring professionals with this skill. I don't know if this at some point will keep on growing and then we would end the deficit. So your initiative would be very much, let me tell you, you're quite lucky. You're very lucky. Well, developers today are quite rare. I've been working in technology for over 13 years, and we see this scarcity of labor. If you take all the companies today, you have software, hardware, all that, and technology to deliver, but you don't have professionals to implement and support these technologies. This piece of data is from the market. We've seen in various media, and recently we've had this technology is going to go into collapse if people don't know. So if we don't have enough people, so we take too long to train our professionals. This is wonderful. In Gilney's management, he's attracting talents just like water, thanks to his management. Let's learn from him. Sorry. So certainly, this is the path. If we have this market situation, it's certainly going to add a lot. It's an ascertained positioning. Gilney, I'm going to learn how you manage companies. Yes. Okay. I want to learn a lot from you as well. So it's been fun to see your case before and now. Congratulations. So there's great positive views. The colors you've chosen, it's really nice. But look, I agree. Just as White Martins mentions, we see a gap. However, we have social collaboration programs in a sustainable form. And amongst them, we have education, especially, well, we have a great gap today, which is labor market insertion of those that combine several elements of diversity, minority, especially social diversity, and cannot jump into the corporate environment. They become outcasts. I don't know about White Martins. Most companies have social inclusion programs, always connected to some organization, some educational organization, usually close to our units and connected to public, private, or semi-public organizations. Then I see an opportunity, and we're totally open to discuss your project. In the formal process, as White Martin says, we haven't had a gap. We do have a lot of professionals, but we would like to have more professionals from the surrounding communities that would be able to work and to take this jump and go into the corporate market in a definitive way. And then I think you give us an excellent tool. Congratulations. I won't allow you to make comments because we're over time, our time. I've gotten some messages here, and then you can connect later. So here's a tip. So this is an ESG trend. We see increasingly number of ESG into their institutions. So I'd like to thank everyone, Gilney and José Carlos. Thank you very much for the invitation. I'm very flattered to be in this panel to talk about healthcare with such influential people and so concerned about the purpose, which is to bring accessible healthcare to the communities. Thank you very much. I hope you have all enjoyed, and please follow our program.